structure and the fact that it's really a way to channel resources directly to indigenous peoples' organizations, with 3 regional organizations in Africa, Asia, and Latin America, who act as direct counterpart for IFAD, but then they can help both the design and especially the implementation of smaller projects that are implemented by local indigenous peoples organizations. The 6th cycle that is now, the final proposals are currently being selected, focuses exactly on advancing indigenous peoples' conservation and sustainable management of biodiversity for adaptation and resilience to climate change. So we really hope to have a lot of learning from this cycle to feed into all the discussion on biodiversity and also on the global biodiversity framework. I have a couple of examples of EPAF projects, just to give you a sense. They are relatively small, meaning that they are up to $70,000 for 2.5 years of implementation, but they are really fully designed and implemented by indigenous peoples' organizations, and they really address the challenges that the community face and they see as priority. So this example, for example, is an initiative that addresses the threat related to food security caused by oil extraction, indiscriminate fishing, and the introduction of exotic species. And through this small grant, the project promoted the farming of a native fish, which resulted really in improved food security by ensuring a sufficient intake of protein for families, and therefore a really clear health outcome, but also had an impact in terms of economic gain, especially for women, and also clearly a recognition of the value of local traditional knowledge. Another similar example in Colombia instead is focusing on identifying native potatoes varieties and selecting those with higher production potential and higher food security and nutrition potential as well. As I said, EPAF is a part of IFAD program, but mainly IFAD works through country programs. So we engage with government through country strategies that are like a duration of 4, 5, 6 years, depending on the countries, whereby the approach to rural development and rural transformation is agreed, and then is implemented through specific investment projects. And IFAD, through both the policy that I already mentioned and its social, environmental, and climate assessment procedures, has a very strong form of engagement with the indigenous peoples community, in particular in applying a free, prior, and informed consent. So just to give you an overview of the portfolio, currently, IFAD project, we have 84 projects in 46 countries that target indigenous peoples with an outreach of approximately 6 million. And this is basically 73% of the new project designed last year target indigenous peoples. This is just the example from which the video was taken. So it's a project in Peru that has, let's say, a larger component on productive innovation and the development of sustainable rural businesses. But it's very important because that it has a specific attention to indigenous women and has been supporting the Hawaju women cultivating medicinal plants and also creating not only market, but also an ecotourism business. And I think the video spoke very well to the success of this approach. Lastly, related to, again, approach and tools, I would like to mention a digital toolbox that IFAD has developed, which focus on indigenous people's food systems for improved nutrition and therefore also for improved health. And this toolbox is accessible by everyone, is available online, and provides guidelines for designing, implementing, and monitoring projects. Of course, it's designed for the, let's say, the way IFA designs project, but it's really very much applicable to very different contexts. And there's a strong focus on biodiversity for food and nutrition, and how a project should start by assessing the opportunities offered in a specific context by biodiversity for food and nutrition, and also provide really step-by-step guidance on also how to take into account indigenous people's views, consideration, and so on, in a way that is then results in a real use of the indigenous knowledge for better health and nutrition. I have a set of resources. Maybe the presentation can be shared, or we can disseminate all the links to these resources, because I think some of them are really relevant for many different stakeholders. And with that, I thank you, and I stop sharing my screen.
Very warm thanks to you, Ilaria. And it is true, I witnessed at the last Indigenous Forum the very large number of projects that were being presented from each of the different regions, and was really very impressed by the diversity of projects and engagement of Indigenous people. So I'm sure there will be questions around this. I would like to actually invite our next speaker, and maybe, I know Ilaria, you're running very short on time, and I know our next speaker, Balakrishna Pisupati from United Nations Environment Program, it is also very, very late for him, as he is also in a different part of the world. So might I invite Bala, if you are online, if you can hear me?
Of course, yes, Christina.
Fantastic. So if you could say a few words, and immediately after your presentation, we will take, if there is one or two questions just for you and Ilaria, and that way we won't keep you even later than it already is for both of you. Would that be suitable?
Sure.
All right, over to you, Bala. Thank you.
Brilliant. Thank you. Thank you, Christina. I hope you can hear me clearly. Thank you very much for the invitation. First of all, it's a pleasure to join you. My name is Balakrishna Pisupati. I head the Environment Policy component at the UN Environment Program based in Nairobi. Of course, one of the areas that is very close to my heart and I've been working for many years relate to not just issues related to biodiversity conservation, the Convention on Biological Diversity, but also issues related to indigenous people, traditional knowledge, and all the related issues. So that way, I'm very, very happy to join you today at this particular meeting, which I am assuming is like a curtain raiser for a larger event that is going to happen in India during August. So with that, what I'd like to do, based on the discussions I had with Christina, is to very quickly move from one level of discussion to another level of discussion. I've just joined the meeting before the last panel concluded for a couple of presentations, and also hearing the other ones, where a lot of focus is on how at the local level, communities and people actually are focusing on the issues of health, traditional knowledge, traditional practices, and biodiversity conservation. I'm going to move to a different level, which is what is happening at the global level, so that you also understand some of these perspectives. And the context of my intervention is to give you a bit of an update on the outcomes of the recently concluded 15th meeting of the Conference of Parties to the Convention on Biological Diversity, the CBD COP, or 15 as it is known. And for those of you who follow the convention in whatever way and form, you understand that there is a specific article of the convention, Article 8 and Section J, that focuses on the issues of traditional knowledge, indigenous peoples, and local communities. But most importantly, the kind of attention some of these issues received during the last meeting of the Conference of Parties has been significant. And of course, Christina will endorse because she earlier was with the Convention on Biological Diversity Secretariat. And the Secretariat started a strong collaboration with the World Health Organizations quite some time ago in coming up with some very specific guidance, with very specific, roadmaps on how to actually link biodiversity conservation and health, fully recognizing that a lot of the work that a number of you are working on at the local level, at the regional level, whether it is on a practice level or whether it is on a policy level, there is a direct link between biodiversity conservation and health. And this work, which actually started as a long-standing collaboration between the Convention Secretariat and the World Health Organization, resulted in a number of products, as I mentioned before. And for those of us who follow this agenda, we really anticipated that we will have a very specific target related to biodiversity and health coming out of the Kunming-Montreal Global Biodiversity Framework. But of course, as you know, many of these negotiation meetings, nobody gets everything, but everybody will get something. So that way, we were not able to get a specific target related to health, but then the issue related to health is spread across a number of targets that now have been adopted. And to just give you half a minute overview of the convention's outcomes, the meeting that was held in December 2022 in Montreal adopted what is called the Global Biodiversity Framework for the period between now and 2030, which coincides with the 2030 Agenda for Sustainable Development and the Sustainable Development Goals, the climate principles, all of it. So that way, it's a very, very important and a significant outcome of this particular meeting. And what the Global Biodiversity Framework does is also to provide countries, which was again discussed and negotiated by the 196 countries that are parties to the Convention on Biological Diversity, is to agree on a set of 23 global biodiversity targets. And the conference also came up with a number of ideas for how to implement the framework, how to realize those targets. And one important element which will receive a lot more of attention in the next coming years and months is for countries to start setting national targets that are relevant to the global targets, but also prepare and update and revise the existing national biodiversity strategies and action plans. And currently, through the Global Environment Facility, 139 countries are being supported to prepare to update the national biodiversity strategies and action plans, and also set national targets. So UNEP, the UN Environment Programme, and the UN Development Programme, UNDP, along with the Secretariat to the Convention on Biological Diversity, currently are engaged very, very strongly in helping countries set those national targets. And one of the very specific issues that are getting discussed is how to deal with issues of health, nutrition, and human well-being as a part of this particular package. We have had global decision, but how do countries pick up these global decisions and make appropriate strategies and policies so that some of the issues that you're discussing here gets appropriate attention? And in that context, we have a number of targets of the Global Biodiversity Framework that are directly contributing to the discussions on health, biodiversity, and well-being. We have target number 5 that looks at management of species and also the risks because of spillover effects of, due to diseases, wildlife trade. We have target number 7 that focuses on pollution and pollution management, and all of us know the impact of pollution on human health, and certainly that is going to be an important target where we will see some entry points for health-related issues. We have target 8 that focuses on the issue of climate change and nature-based solutions. And many of us who work in this area, whether you're working at the local level or regional or global levels understand that the impact of climate change is significant in terms of the disease burden across local communities